Okay, encourage members leaving the chamber to do so as quickly and as quietly as possible. We move on to the final item of business, which is a members' business debate on motion 16452 in the name of Sharon Dowie on improving access to hearing care for Scotland's ageing population. The debate will be concluded without any questions being put. I invite members wishing to participate to press the request to speak buttons, and I invite Sharon Dowie to open the debate around 7 minutes. Ms Dowie.
Thank you, Presiding Officer. I'm delighted to be able to bring this vital topic to the Chamber for members' business, and I thank colleagues from across the Chamber for supporting this motion, and I look forward to hearing their contributions later. We often debate Scotland's ageing population here in the Scottish Parliament and the various ramifications it has for health services, communities, families and quality of life. Of course, the fact that people are living longer is a good thing, and it should be celebrated. Nothing could be better than being able to spend more years with our loved ones. But as parliamentarians, we cannot afford to ignore the challenges it presents too. Like almost all Western countries, Scotland has a declining birth rate, and on top of that, the number of over 60s is projected to increase by 50% by 2033. This is especially true of the area I live in and represent. South Ayrshire is the fastest ageing local authority area in Scotland, and by 2043, 1/5 of its population will be over the age of 75. I'll speak later about the significant impact this has on the local population and providers. We've heard many times about the various pressures this will place on the healthcare system, from the number of staff needed, the resources required, and the imbalance between a smaller working age population paying taxes to support an increasing number of people who have served their time at the coalface and now deserve to enjoy retirement knowing there is a stable and reliable healthcare system behind them. Today, I would like to talk specifically about audiology services. As my motion states, it is estimated there are more than 900,000 people in Scotland living with age-related hearing loss. As a result of this increasing number, services across the country appear to be struggling to keep up. I appreciate that the Scottish Government has identified this as a key priority for improvement and hope today's debate goes some way towards helping this happen. We know from research that waiting times for various audiology appointments are too long, and some people can be left for several months without getting the help they need. And we know, like almost every NHS service, that things are under so much strain, hard-working staff are struggling to keep up with what is an ever-growing workload. But there's more to it than that. Hearing loss is different from many other ailments, which are frequently debated in this chamber. It can be hard for an elderly person to come to terms with the fact that their hearing is worsening. It can often be years before someone can be persuaded to seek help, and by that point, significant damage will be done. Social isolation, depression and loneliness are all exacerbated by hearing loss. And worst of all, it's been identified as the single largest avoidable risk factor when it comes to dementia. So improving services must also take account of what we can do to encourage elderly people and their families to step forward. And when they do, we must ensure the NHS is ready for them. It's not just at that first appointment either. The aftercare system is equally crucial, especially as research suggests people can abandon things like hearing aids if they don't get comfortable with them quickly. We also need to ensure services such as maintenance and battery replacements on hearing aids are up to scratch, especially in rural areas. There are a number of private providers who step up too, such as Specsavers, and we should not be afraid to listen to these organisations when it comes to creating the very best services. I met with the Specsavers team in Ayr last year to learn about the work they're doing to support people with hearing difficulties. Thomas Allison, the Audiology Director, and Linda Fulton, the Retail Director, spoke at length about the challenges facing people in the area. They are aware of the demographic challenges within NHS Ayrshire and Arran, where they estimate nearly a quarter of the population have some form of hearing loss. Around 4,000 adults in the Health Board area are waiting for their first appointment for hearing issues, with the average waiting time anywhere between 18 months and 2 years. The staff there hear the horror stories from locals every day, many of whom have come to Specsavers because they've given up on the NHS. I also heard how things are different in England, wherein any qualified person scheme is in operation, meaning some of the care usually provided in hospitals can be done on the high street, so long as those doing it are qualified. Given Specsavers have a proven infrastructure for this elsewhere in the UK, it would surely be of use to Scotland and to Ayrshire too. They also told me the importance of creating a positive environment for people to come in for follow-up care, and how many returning customers enjoyed chatting with the staff while getting their hearing aids cleaned. Working alongside our NHS, companies like Specsavers can absolutely contribute to an audiology landscape which is ready for the demographic evolution we face. I know there have been tensions in the past between official audiology services and what is offered on the high street, and we must all work together to ensure these two strands work with each other rather than in opposition. We may even get to the point where more patients could have their hearing loss managed in the community, which would take the pressure off hospitals and could even save money. Presiding Officer, the Scottish Government has stated in the past it would like audiology care to be on par with what is offered in eye care services. That is an aspiration with which I fully agree. We don't always find consensus in this chamber, but I hope in this issue we can come up with a plan to help the hundreds of thousands of elderly people struggling with their hearing who need exactly that. As I've mentioned, there are professionals in Ayr who deal with this kind of thing every day and know better than anyone the challenges we face. But they've got some solutions too, and MSPs in this place would benefit very much from listening to them. And I just want to finish off by mentioning something a doctor told me last week. We'd actually met to discuss women's healthcare, and she had great ideas on how to improve the service that we currently give. But one thing that she said could be applied to all areas. You can choose to deliver the service differently, and I think that's what we need to do. Thank you.
Thank you, Ms Dowie. We now move to the open debate. I call first Christine Graham to be followed by Ros McCall. Around 4 minutes. Ms Graham.
Thank you very much, Deputy Presiding Officer, and I congratulate the member on securing this debate. And perhaps I should declare an interest as the Parliament's only and perhaps last octogenarian MSP. Well, at my age, you certainly become aware that your hearing is not in such sharp shape as it used to be in your youth. It's a realisation, rather like needing glasses, which sneaks up on you. I had compensated for my short-sightedness, recognising people by their gait and the sound of their footfall. I can still do that. I didn't realise until I couldn't read a notice board in a lecture room that there was more to it. Glasses and now contacts are a liberation. Hearing loss follows a similar path. I began to notice I preferred to sit in the middle of a group because then I could more clearly hear the conversations. Ambient noise disrupts your hearing. Your whisper, and my colleagues will identify with this, is more of a stage whisper. You say pardon or sorry far too often. The difference is that people don't find reduction in your vision funny, but in hearing, you certainly can become the butt of a joke. Time that stopped. Loss of hearing, small or large, can have an impact on your well-being. You may keep apologising when you have absolutely nothing to apologise for. I would also slip in here the importance of earwax removal by a professional. It might not be the sole source of reduced hearing, but it certainly doesn't help. However, not all GPs now provide this service, and at around £60 if you go private, it's not an option for everyone. Now, as more of us thankfully grow older in Scotland, it is no surprise to find that currently just under 1 million adults have their hearing affected, and demand for services is expected to rise significantly as the population ages. Indeed, the number of over 60s is projected to increase by 50% by 2033. I'll not be around then, I don't think. But all is not lost. In Midlothian, the Council has developed a strong partnership with Deaf Action to support residents of all ages living with deafness or hearing impairment, including, just as just one sample, outreach and home support, covering health, financial and social issues. In the Scottish Borders, there is the RNID Near You service, a community-led success. 2,497 people were supported in 2024 through local drop-ins, phone and online support. Over 4,300 individual interventions included 1,907 hearing aid support interventions, 2,347 information and advice sessions, and indeed 116 hearing checks. But as everywhere, including in Midlothian and the Scottish borders, there are funding pressures and, of course, accessing services in rural areas, which we all appreciate for reasons I don't need to expand on, are more expensive. So bringing audiology into community settings on par with Scotland's iCare model would be most welcome. That early intervention could prevent more serious ear conditions developing, helping tackle preventable mental health problems, cognitive decline and isolation, of which can be linked directly to hearing loss. And frankly, quite brutally, it would save the public purse. There is that well-worn mantra, but it's still worth saying again, spend to save. So indeed, I'd like to see the government moving to the same kind of access as we have to free eye care and eye tests to audiology. Thank you.
Thank you, Ms Graham. I now call Rose McCall to be followed by Carol Mocha in around 4 minutes. Ms McCall.
Thank you, Deputy Presiding Officer. Firstly, I'd like to congratulate my friend and colleague Sharon Dowie for securing this debate tonight. This is such an important issue and it's not spoken about enough. And it's disappointing to me that so many of the really fundamental issues that are affecting the people in Scotland are debated in members' business when so many MSPs have other commitments and without the full focus of the government. But that's not to say that the Minister will not, I'm sure, listen to the debate intently, and I sincerely hope progress is made on this issue, because I'd like to highlight the issue of hearing loss and dementia. We know that Scotland has an ageing population. We know that health and social care demands increase exponentially as we get older. Now, whilst dementia is not an elderly person's disease, it does primarily affect people over 65, with 96% of cases in Scotland affecting people over that age. And what concerns me the most on this issue is that even though we know that there are direct links between sensory loss and dementia, we don't routinely test for sight or hearing issues when we diagnose a person. How can we be sure any treatment plan will work for the patient if we don't know the levels that they can see or hear? After this debate, I'll be attending the Cross-Party Group for Deafness, where I work with some fantastic people on the issues surrounding deafness and deafblindness in Scotland. And the group has been working on a report which highlights the problems in the current diagnosis pathway, which cannot help but have a knock-on effect on treatment. The result from the surveys put out for the report highlighted that only 6% of GPs and 12% of other health and medical professionals would assess both sight and hearing as part of an integrated assessment on memory loss or memory or dementia. Now, this is a big problem, as most dementia assessments rely on the person being able to see or hear the questions. We are diagnosing somebody with dementia without considering whether they have had any sensory impairment. And as Dr. Hannah Tweed from the Alliance highlights, brain changes caused by dementia can have similar symptoms to deafness, deafblindness or visual impairment. But many people experiencing both dementia and sensory impairment. But even when the standard dementia assessments are done, the results aren't able to separate dementia brain changes from sensory impairments which commonly overlap. So the question therefore must be asked, how do we know if we're actually diagnosing dementia? Now, the Alliance is calling for sensory assessments to be a mandatory part of dementia assessment, and considering that dementia cases are set to rise by 50% in the next 20 years. This is not only prudent to ensure we're diagnosing the issue correctly, but have adequate treatment plans in place for a person, and that's also essential. A lack of proper sight or hearing assessments, or even clear guidance on who is responsible for that assessment, can lead to poor and inadequate care, or at worst, people's sensory impairments being continually missed. So in conclusion, I know that work has started with Health Improvement Scotland sign guidance towards how next steps can be taken in implementing some of the dementia report recommendations. And I would urge the Scottish Government to work with Alliance and HIS towards making this happen. And I look forward to a time in Scotland where sensory assessment is just a matter of routine, with everyone having access to improved care pathways and support for people who not only have dementia, but also experience deafness, deafblindness and visual impairment. Thank you.
Thank you, Ms McCall. I now call Carol Mochan to be followed by Douglas Lumsden in around 4 minutes. Ms Mochan.
Thank you, Presiding Officer, and thank you to Sharon Dowie for bringing this debate to the Chamber. It's an area I have also recently discussed with constituents, audiologists and third sector groups supporting older people within my region. As we've heard, hearing loss is actually very common. In fact, it's one of the most common disabilities in the UK. In 2015, Action on Hearing Loss estimated that there were 945,000 people living with hearing loss in Scotland, 1 in 6 of the population. The statistics, as we've heard tonight, do speak for themselves. This is an issue that affects so many people and their families. Over half the population over 55 have some form of hearing loss, and the presence of hearing loss rises with age. It is estimated that 70% of over 70s have some degree of hearing loss. And given the demographic changes in our population, the prevalence of hearing loss is basically set to continue, as we've heard from other members. And so I think it is right that Sharon Dowie is raising it tonight, giving us a real opportunity to discuss options for future service delivery. It's of course real stories that shine a light on these things, and during my research for this debate I was particularly struck by some of the words from Catherine, a retired nurse, and some of the literature that we had from Spice. And she said, "The best thing for me is feeling whole again. My hearing loss happened gradually. I didn't suddenly realise it was a problem. I was continually asking my husband to turn the television up and would often take a back seat in social situations." And I think that many of us do know that it is this social isolation that can be so hard for people. I particularly liked what Catherine said after she got hearing aids. It was incredible the first time I listened with them in. The immediate impact of being able to hear again was realising how much I had missed the joyful sound of birds, and I believe it lifted my mood, and I think it increased my confidence. So it's really important for people. And she said that she really began to reappreciate music, hearing children, all the things that really lift our spirits and make us feel positive. So it is that real impact for people. One of the other things that I hadn't really considered is that she said I felt safer because I could hear cars coming and things like that. So wearing hearing aids, she said she did with pride, which I think is an important point. I also wanted to mention the impact on families. We know from research from RNID that 9 out of 10 of us would feel really upset if a family member was missing out on a conversation or avoiding having a conversation because of hearing loss altogether. Yet 1 in 3 say that a family member regularly doesn't hear them or asks them to repeat themselves. And despite this, many of us struggle to know the right way to speak about this issue with people. And I would agree that that is my own experience. It's that everyone else in the household and the wider family are talking about how bad things are or how frustrated they are by a member of the family not hearing them, but they rarely mention that to the individual who is suffering from hearing loss. So again, it's so important that we discuss these matters and help encourage people to talk freely about what is happening to them or their loved ones and talk about what can actually be done. So that brings me to the point that really we are here tonight. There is no doubt in Scotland we must galvanise ourselves to implement NHS community audiology services to ensure access to this incredibly important service. We know that waiting lists are long in hospital settings, but there are opportunities, and I think many people would want to have these opportunities within the community. My colleague Jackie Bailey asked a recent question, and in response to that question, the Government said audiology is considered as a clinical priority area, and the Scottish Government remains committed to its vision for an integrated and community-based hearing service. And so within that response, they also mentioned that they want to continue to work with the NHS, third sector and private providers to identify and cost an appropriate model of community care for any future service development. In closing, I just want to say to the Minister, I would be really interested to hear what the options are, because I think we need to make sure that there are options there. I wouldn't like to see us just go down a road of using private services. So it would be really good for me to know if you have managed to get that work done. And given the time, I will close there. Thank you, Presiding Officer.
Thank you, Ms Mochan. And then I call final speaker in the open debate, Douglas Lumsden, again around 4 minutes.
Thank you, Presiding Officer. And can I just start by congratulating colleague Sharon Dowie in securing this debate. And I feel it's a debate that we shouldn't be having. We shouldn't be in a situation that we're in just now. But the system we have in place just now, I feel, is cruel. You know, audiology is a service that is in crisis at present. And imagine, Presiding Officer, saying to an elderly person, I'm sorry, but we're not going to be able to see you for 2 years. I think we in this chamber can all recognise how inhumane that would be. But when you look at the waiting times in NHS Grampian, for example, that's what people are having to wait. They're having to wait 2 years before they get an assessment and then wait further to get a hearing aid. And as Christine Graham points out, you know, that's leading to social isolation and also links to dementia, and also the impacts on family and the sort of community settings. Because I can imagine that you can only say pardon once or twice before you actually withdraw altogether from engaging in conversation. So I think it is something that is, you know, should really be looked at as soon as possible. And, you know, the answer is clear, and I think it's been accepted by all. We need to get people out of a hospital setting. You know, 94% of people with hearing loss have uncomplicated adult onset hearing loss, suitable for community treatment. And at present, these patients compete for the limited capacity available to treat children and adults with sudden onset hearing loss and specified comorbidities who have to be treated in hospital. And there's absolutely a need for intensive audiologists in major hospital settings, but these specialists should be reserved for the other 6% of cases, traumatic hearing loss or child hearing loss from birth. But just now, so much of that resource is being spent on people that shouldn't really be in a hospital setting and should be in the community settings instead. And as Sharon Dowie pointed out, you know, we already have a solution in our communities. Companies like Specsavers, who I also went to visit on Friday, even got a hearing test done. You know, they're providing that service already. And, you know, as we've said, you know, in terms of community eye care, we do that already. So surely we should just replicate that for hearing. I would like to thank, I had actually met with Neil Gray and Jenny Minto a couple of months back, and you know, this was one of the things I spoke to them about, because I'd raised some questions on this. So, you know, I thank them for that time. And, you know, I would like to say that NHS Grampian, that would be an ideal place for a pilot on community audiology. There is huge waiting times. There is a real need for something to be done. So I would urge the government to take on the seriousness of this, take on the urgency of this and move with pace, because these are mainly elderly people who are maybe reaching the end of their lives. We need to look after them, and we need to make sure that they can communicate with everyone else as much as possible. Thank you, Presiding Officer.
Thank you, Mr Lumsden. I now invite the Minister to respond to the debate. Around 7 minutes, Minister.
Thank you very much, Presiding Officer. And I too would like to thank Sharon Dowie for bringing forward this motion today, and I welcome the opportunity to conclude the debate. And I'd also like to thank everybody for the tone of their contributions, because it's clearly something I think that we all agree about. And I note the comments that Ros McCall made about the connections with sight and hearing loss and dementia. And although dementia doesn't sit within my portfolio, I know that Ms Todd will be very interested in the conversations, the points that you raised. I recognise it from my own personal experience as well about the importance of supporting people that live with dementia with regard to their sight or their hearing, to avoid that loneliness, as many people
have commented upon. At the outset, I would like to reiterate the commitment of the Scottish Government to seeing improvements in the way that audiology services are delivered. The publication of the Independent Review of Audiology Services in Scotland highlighted some real failings within the way that care was delivered within Scotland, but also recognised opportunities to build upon these to give real improvements to those who use the service. And as Sharon Dowie and others have pointed out, the number of adults in Scotland with age-related hearing loss is growing, with almost 1 in 6 of the population experiencing some form of hearing loss. It's right that we need to be able to provide a clinical service to these patients that meets their needs, not only to diagnose their condition in a quick and efficient manner, but also to manage their condition and lessen the impacts of social isolation and loneliness. I too will be attending the CPG tonight. I was really struck by Christine Graham's comments on stigma and the differences in the way that we treat sight and hearing, and I will take that away when I'm speaking to my officials again. I had a conversation with them this afternoon with regards to the work that the Scottish Government is doing on audiology more widely, and I'll take the intervention.
Christine Graham.
I'm very grateful on that point, and I think that's one of the reasons why many people disguise the fact that they can't hear what's going on, which makes it worse for them. They suppress that because they know it's going to be amusement to many people.
Minister.
I think Christine Graham raises a really important point there, and while she was speaking, I was thinking about the difference between my father wore glasses from a very young age, and he could only have the NHS style ones, and now there's so many different styles that you can get. And with hearing aids, there's possibly the same stigma about the size of hearing aids as opposed to the much smaller ones that are currently available. I think that was a really important point, well made. As with many of our clinical services, waiting times are increasing and patients are not able to access this as quickly as we would like. However, in the 25-26 budget, it provides record funding of £21 billion for health and social care, and health boards are receiving an additional £200 million to reduce waiting lists and help support reduction of delayed discharges. This funding, I hope, will be a welcome addition to health boards and should build on the work that they're already been doing to address waiting times by reducing their failed to attend rates and patient-focused bookings. References have also been made to the SNP manifesto commitment to bolster community audiology provision to help free up capacity in our acute sector, and the Scottish Government remains committed to this vision. We're all familiar with the manifold benefits that increasing community provision brings, both in reducing the cost of services but also in supporting patients to receive care when they need it without the constraints of waiting times, as people have referenced with regard to services within opticians. Sorry,
Douglas Lumsden.
Thank the Minister for taking the intervention. Good to hear that she's still, the Government is still committed to community audiology. Would there be any sort of timescale that the Minister could give on when that sort of change would start to happen? And would she also reflect on its, getting access to the service initially is only one thing. It's the follow-up, I think, is missing as well. I speak to so many people that have got NHS hearing aids, but they never actually go back to get them checked or anything else. And I think that's something that we're missing out on as well.
Minister, I can give you the time
I'll
back.
touch on the second point of Mr Lumsden's intervention later on in my speech. And I'm afraid I can't give timelines, but that conversation started earlier today with regards to moving on audiology within the community. The Scottish Government has a strong desire to deliver care as close to the patient as possible, and this is an example of where our population-based planning principles will provide benefits to both patients and staff. As I highlighted earlier, we've been working specifically on the Independent Review of Audiology Services in Scotland report, and that is part of the work that we're doing on ensuring we've got the right evidence base and delivering value for money and ensuring sustainability into the longer term. The commitment is evident through our ongoing work with the Royal National Institute for Deaf People to deliver the Near You service, supported by nearly £250,000 worth of funding. And Christine Graham mentioned this in NHS Borders. Well, I had the privilege to see the work firsthand during a visit to Portobello Library in NHS Lothian in February. And as Christine Graham noted, Near You offers free hearing checks, hearing aid services and aftercare, as well as information and peer support on areas such as hearing aid maintenance and assistive technology for those who are deaf, experiencing hearing loss or tinnitus. The feedback from users has been extremely positive, not just in decreasing the pressures of our acute services, but also in providing direct support to those affected. And I would say, in response to Mr Lumsden, that I think that's one of the key things that we have to remember that we can do. I say this in a lot of meetings, that it's working together with the third sector and also health boards and government to make these connections. And what I heard from users of the Near You service, but also our RNID who were providing that service, was that importance of the relationship, that they felt that they could take people away from the front door of hospitals to allow hospitals to treat those with more acuity. So I think I agree with Mr Lumsden that we need to make sure that there is that aftercare, and I think where we need to check is where that aftercare is best placed. Ms Downey, Sharon Downey, also notes the position of independent audiology, as did others, and that they have the skills, IT connectivity and capacity to support our audiology services. And I don't disagree that independent audiology providers are giving a great level of care to those who use it. However, NHS continues to be the majority care provider for the people of Scotland, accounting for around 80% of all audiology care. We must also recognise that due to shared pipelines, independent providers face similar workforce challenges to the NHS, and we're working to address this shortfall in trained audiology graduates through our commitment to develop a career pathway for those studying healthcare sciences, working with stakeholders across Scotland to ensure that this will provide a pipeline of staff to bolster audiology services. Overcoming these workforce challenges will not happen overnight, and it will take time to support students in our workforce. During that time, it's therefore vital that we work together to ensure that the people of Scotland receive the care they need to manage their conditions. And I commit to keep any lines of communication with representatives from independent providers open, and will invite their input when discussions on development of community model for audiology progress. And to bring this to a close, I agree there is much to do and that it's vital that we get this right for the people of Scotland. I am confident that we in Government are already taking the right steps to deliver sustainable, safe, effective and efficient services to support hearing loss for our population in the longer term, and it does have my full focus.
Thank you, Minister. That concludes the debate, and I close this meeting of Parliament.